We have a number of programs that begin in September and go through May, and this is just a heads up that our program for February has been postponed to next fall. And that's Jack Russell's program on old farm tools. It'll likely still be at Russell's Garden Center when we have the program, but you know, he was bit by a tick. What can I say? So, yeah, not good, not good. However, so the next program is in March, late March, March 24th, and Jane Siaka, our curator at the Historical Society, will be doing a program on female abolitionists in Wayland before Lydia Morat Child, who everybody knows about, right? So, and that will be here in the library as well. So I thank you all for coming. This is Tony House. He was.
I don't ask for applause. All I want after I finish is a 10-yard start.
Right, and he's not even using these tools on him. So, Tony was born in London. He came to America in 1969 to work in Houston, Texas. Can you imagine coming from England to Houston? Quite the shock. Just as the first man landed on the moon. So he came to do postdoc research, and then he went on to Stanford, California to study medicine. And then to Framingham, Massachusetts, to work at Brigham and Women's Hospital in Boston. Tony and his family live just south of the Sudbury line in a neat old place. He retired from medicine, but enjoys being involved in local history as well as learning about the history of medicine. And that, of course, is this program will focus on a piece of that large field. And thank you, Tony, for coming.
Thank you very much. Thank you. Thank you. And I don't mind if you look at your watches when you get near the end of this. All I ask is you don't put them to your ear. I'd like to thank Molly for inviting me to do this. This is the first time I've done this type of talk, and I have to admit I'm not a professional medical historian of the 18th century. I hope you're not too disappointed, but I am a member of the Sudbury Minute and Leisure Company, so I do know something about this area and that era. Today we're going to talk about the practice of medicine in the 17th and 18th century. And while I was preparing for this, doing some reading, I ran across this piece of information which kind of puts quite a shine on it. By the time of the battles of Lexington and Concord in 1775, the average life expectancy was 33 years in British America. 1/2 to 2/3 of those under the age of 2 years old were dying of disease, infection, and poor diet. Almost 1/2 of those who survived into adulthood, and that's over 16 in this definition, would have a noticeable loss of sight, hearing, and teeth, and even impaired reasoning. So we have this sort of romantic vision of the 18th century, or as I do, but it really wasn't that great. Now, it sounds pretty bad, but actually things here weren't any worse than they were back in the homeland, back in Europe, particularly in England. In fact, people here in general were healthier certainly if they survived through childhood, because the conditions were less crowded, water was cleaner, and people had more activity and just tended to remain healthier. But despite all of that, disease was pretty rife. Now, the people obviously got sick, and the diseases that they had were exactly the same diseases that they had back home. There was really nothing that they picked up here, despite what other people might have thought. Everything that they suffered from here in the way of disease was stuff that they had brought from Europe. And in the early time of colonization, there really were very little, virtually no understanding of what caused disease. And when people got sick, they would try various home remedies and wait. But if they got very sick and very concerned, the only recourse they had pretty much was to go to the most educated person in the community, which would have been the minister. And the minister was probably the only person who had a university education, which included learning all the latest theories of medicine, and they would go to him. But unfortunately, they probably wouldn't get a lot of practical help, because at that time it was thought that disease was really caused supernaturally, and it was a sign of happiness of God, really, that he's bringing this stuff down upon us. So the preachers, his only recourse was really to try to help by encouraging people to pray and fast. And we have an example here from this town. This is an extract from the diary of the Reverend Israel Loring, who I'm sure you're all familiar with. He was the minister here in the early part of time of the town. And this is dated July 13th, 1721, when there was an epidemic of smallpox in Boston. And he wrote in his diary, "Inasmuch as it pleaseth Almighty God to visit the town of Boston with the smallpox, and thereby to stretch out his hand against the whole province. Therefore, this day was set apart as a day of public fasting and prayer. In the AM, I preached from Hosea 9:12. We also unto them when I shall depart from them." Not very cheery sort of sermon. In the if you didn't enjoy that, then you come back in the afternoon in the PM, and he would preach again for another couple of hours, based on a passage from Amos, chapter 4, verse 10. "I have sent amongst you the pestilence." So this is basically how you dealt with disease at that time in general, particularly epidemics. Now, as far as seeing a doctor was concerned, that was extremely difficult for a very long time. There just was a great shortage of medically trained people in the colonies until quite late. And most people resorted to home remedies. There were plenty of booklets going around giving you advice as to what to do if you had the sickness. And I won't go into them now, but most of them were pretty horrendous and probably not at all helpful. But there were plenty of people who practiced forms of medicine, and the early practice was based on what was done pretty much in England, where healthcare, as it might have been known, was distributed between at least 4 different types of people. There was the physician. This was a man concerned just with internal disease. The term physician comes from the word physick, which is an Old English word meaning the practice of medicine using knowledge of nature, or what they thought was knowledge of nature. The other person who was able to help out at times was the apothecary. This was generally a man, but could have been a woman, and they were concerned with preparing medicines, usually as prescribed by the physician, but often these were prescriptions or concoctions that they would have made up themselves. Another person that you could go to if you needed it was the surgeon. And unlike the physician, who was definitely hands-off, the surgeon was a man concerned with external problems of the body, which required working with the hands, and that's where the word surgery comes from. Old Greek word chirurgery, meaning chiro is hands, is work. It literally means working with the hands, which physicians were expected not to do in their education. This was frowned upon. The other person who might give you some kind of medical advice and help was the midwife. These, for a long, long time, these were always a woman who assisted the mother during childbirth. Midwife, again, is an Old English word meaning with the woman. That's what that means. And as you know, it was a pretty high-risk profession. So I want to look a little bit more closely at each of those and show how they blended together eventually to end up with the local country physician. And then towards the end of this talk, I'm going to use extracts from the work of Dr. Ebenezer Roby from this town, which illustrates, I think, very well exactly how they used to go about their business. So the physician. Here's an example of what a physician might have looked like at that time. The physician was a thinker and a theoretician. He would have been university educated, and his education would have involved studying the classic works of science and medicine which were written by the Greeks and the Romans. He was expected to be fluent in those languages so he could study the books firsthand, and the Latin and Greek were required from any educated person at that time because it was considered to be an international language, and if you were ever going to communicate with doctors from another country, you would always communicate in one of those languages. The physician in his education his education would have been purely theoretical with no practical, hands-on type of work. To get that experience, after education, he would have had to go and work as an apprentice with a qualified doctor, or in some cases he would have to travel over to Europe to work in a hospital there. They had the equivalent of what would be thought of as teaching hospitals, where consultant doctors and surgeons would go around and, for a fee, would let them touch their patients. So all the physician would really learn in university would be the theories of health and disease. And in the early part, certainly of the 18th century, that theory was still the theory of the humours. And I'm sure you're all very familiar with this because it's something everybody should know. The theory of the humours was a theory of health and disease that was derived in the times of the Greeks and the Romans empires, which extended from the original Greek idea that the universe was made up of 4 elements. And those elements are air, fire, earth, and water. And most famous sort of Roman Greek medical man called Galen, took this idea and said, yeah, the body is composed of 4 humours, or fluids, blood, yellow bile, black bile, and phlegm. And like the elements, they have various qualities. They're not all the same. They can be modified. And the modifiers, or the qualities, vary from warm to cold and from dry to moist. So, for example, blood, like air, was considered to be warm and moist. Yellow bile was considered to be warm and dry. Black bile, cold and dry. Phlegm, cold and moist. So, clearly, logically extending from this, you say, well, they must be related to the seasons, because the spring is warm and moist. So blood likes the spring. You know, the blood humour does well and influences your body a lot in the spring. And similarly, summer is warm and dry. This is Mediterranean climates we're talking about here, not New England. So yellow bile likes the summer. It's a good time for this humour to be working. Black bile is cold and dry, so it likes the autumn. That's a good time to have the black bile working. And phlegm is cold and moist, like the winter. So this theory sort of made a lot of sense to people. Yeah, you know, if you think you're in a cold climate and you're sick, maybe it's because you need more blood. So why don't you go to a warm climate, and then that will work better, which actually makes a lot of sense, and that's probably what we would do now, but that's how they would argue about it. They even extended these humours to the idea that they affected people's personality and temperaments. And as you know, we still use these terms today. Blood, the Latin name for that is sang. So if blood is prominent and acting, your temperament is sanguine, or optimistic, hopeful, playful, carefree. If yellow bile is predominant, your temperament might be called choleric, because yellow bile was also known as chole, like cholesterol, to do with bile. Black bile or melanchole, if that was predominant, you would be melancholic. You'd be quiet, despondent, serious. And if phlegm was predominant, you would be phlegmatic, which is calm, thoughtful, patient, peaceful. So all these different temperaments and personalities were explained by various movements around these different humours in your body. Now, this made a lot of sense to those old doctors because this gave them an explanation for why people got disease. With this theory, the humoral theory, disease was considered to be due to an excess or deficiency of any certain humour. What they would say is that the humours are not in balance. They should normally be in balance, so you feel well, you're confident, everything is working fine. But if they're out of balance because you've got too much or too little of some of those humours, then you'll be sick. So the next logical step is to say, well, if you've got too much or too little of humour, you need to redress that, you need to fix it. And the way they approached this, they said, well, excess of a humour could be removed by various ways, by bleeding, purging, sweating, diuresing, making people to produce more urine, vomiting, or if you wanted just to remove humours or fluids from a certain part of the body, not the whole body, you might do it by producing blisters. And these were all done a lot. And that first quotation I mentioned about, you know, the mortality of people during the colonial period was followed up by this author saying, it may be surprising to learn that most people in colonial North America, particularly at this time, had regular purgings and bleedings just to stay healthy. It was considered a good thing to do. If you had a deficiency of a humour, this possibly could be corrected by changing your diet, taking certain medicines, certain types of exercise, or changing your climate. So this was a nice theory, and it stood around for a very, very long time. Not because people thought it necessarily was such a great theory. Certainly in the Age of Enlightenment, in the 18th century, most people questioned this, but they just didn't have anything better to replace it, because until the 1850s and later, nobody knew anything about germs or chemicals in the body, you know, hormones, all the sort of things we know about today. So this really had to explain how to at least treat disease. Towards the end of the 18th century, when people realized this humour idea just doesn't make any kind of sense, but they thought doing purgings and bleedings seemed to work. They rationalized it by saying, well, what you have to do is remove noxious substances from the body, and this is how you do it, because disease is caused by some poisonous chemicals, not necessarily too much or too little humour. So the physician, as I said, is the theoretician, and he would look at his patient. His examinations were somewhat limited. All he could do is look at the body externally, look at the skin, look at the colour, rashes, anything like that. And he might examine the urine for the colour. He might taste it, you know, to see if it was sweet, because if it was sweet, that meant you probably had diabetes mellitus. And he would feel your pulse. They were very good at feeling pulses in those days. They could detect a very wide range of patterns of pulse. We sort of kind of lost the ability to do that nowadays, but we do have machines that will do it for us. So the physician, with his education, knowing these theories, looking at the patient, doing his limited examination, would decide what needs to be done. Your humours are out of balance, mister. We need to do something about that. So he could either do it the patient could do it either by taking some medicines that would either help to get rid of those humours or replace some of them, or he could go to a surgeon. So if he was going to get medicines, he would go to an apothecary. Now, an apothecary is the second type of health specialist that I mentioned. And this was a man, usually, well, it could have been a woman as well. Often families sort of ran apothecary businesses. And this picture sort of shows sort of nicely the relationship between the doctor that he might have had with his apothecary. The apothecaries were only expected to make formulations. The doctor, the physician was expected to make a prescription as to what he wanted. And in those days, literally everything on the planet potentially could be used as a medicine. Every type of animal's organ, every type of plant or tree, every individual part of it, the bark, the roots, the leaves, the flowers, everything, and minerals, salts, rocks, stones, everything at some point in time has been tried as a medicine. And people had been convinced that some of them worked. So they got into the formulary, into a book. And the apothecary would know this book. He would probably have access at least to a very large herb garden, so he could get all the herbs he wanted. Although many of the herbs had to be imported from the other side of the world, from the East Indies or from South America, the ones that were very, very popular. So here we see our apothecary grinding with a mortar and pestle, probably some bark from this bottle here, reading the instructions from his formulary. He would weigh out the different components very precisely on his scale, and he would try to make them into some sort of formulation that was ingestible, that could be either swallowed or drunk somehow by mixing it with other various things, maybe some alcohol that would dissolve it, maybe with something sweet, some syrup or jam or something that would make it bearable. So we have this position here, we have a physician talking to his patient in the next room saying, "Don't worry, Mrs. Jones, I've given my prescription to the apothecary who's making it up right now, and in a few minutes you'll be feeling fine." It still happens today. Now, the types of medicine that the apothecary made can be put into two groups like this. One group would be called palliatives, which means medicines that are meant to make you feel better. You go to see a doctor and you're unhappy, you're in pain, you feel sick, and he's decided that this is not a terribly serious problem, but I'll give you something that'll make you feel better. So he would have access to many, many different types of materials, and I've sort of listed them here as these different things. For example, anodynes are pain medicines, relatively mild pain medicines. And he had a lot of things available to him. Willow bark was very popular. If you grind it down, powder it, make it into a pill, basically what you have is aspirin, because acetyl salicylic acid comes from willow bark. Opium was very available, but it was more expensive, but it obviously worked. Myrrh was very popular, again rather expensive because it had to be imported from the Middle East, but it was very, very popular for relieving pain in the mouth, and pain in the mouth was pretty common in those days for all sorts of reasons, not least of all because of lots of problems with tooth decay. Nux vomica is the name of a popular pain medication which seemed to work because it contained strychnine. It was from the strychnos plant, and in small doses apparently it's quite a good pain reliever, but it's not recommended. Now, there are a lot of medicines to treat arthritic pains, and arthritis. It's interesting. They didn't use the term arthritis in those days, but they did notice that patients frequently got swelling and pain in their joints, and they thought that this was due to the humours, some bad humours, dropping into the joints, and the Latin word for drops is gutta, and so they called these things gouts. Was the term they used for arthritis, and we've pretty much got away from that except for one type of arthritis that we still call gout, but that's where the name comes from. It comes from the old humoral theory. But again, as you'd expect, willow bark with aspirin would be effective. Wintergreen also contains the same chemical in aspirin. And another one, colchicum, is the autumn crocus plant, which we now know contains a chemical we call colchicine, which is very effective in gout, we call gout. So they did have some effective medicines then. Antipyretics or medicines to lower your fever. Saying willow bark is aspirin, it's good for that too. Peruvian bark was very, very popular. And this, as the name implies, was a bark from a tree first found in Peru, named the cinchona tree. And it was found that it was very good at getting rid of the fever that people had associated with malaria, which was a remitting fever that came every 3 or 4 days, or remitted every 3 or 4 days. And so it was just assumed that they didn't really know what malaria was, but they knew if you had a bad fever that this bark would work. So they used to give the Peruvian bark pretty much for every fever if it was a bad one. Contra yerba, it's a plant that gets its name Contra yerba, and the reason I'm using these particular medicines is because they were very popular with Dr. Roby, as you'll see. There were many, many others, but there's just not enough room to go into all of them. But Contra yerba was a plant that he liked a lot, and Contra yerba means against contra yerba, herb, and it was first used as an antidote against poisons, particularly herb poisons. They found that this would work, but after continued use, it was found that it was very good with fevers in general. Carminatives, meaning nowadays we would call these medicines for gas, were very popular. These were the most commonly prescribed medicines in the 18th century. And it's probably because bowel problems were just very common back then, for all sorts of reasons, diet and the water, and who knows what else. But you will see, with Dr. Roby, he'd love to give up lots of this stuff. But the most popular formulations involved aniseed, balsams, which are resins from many different plants, usually from an evergreen tree, but they were then mixed, the resin was mixed with a herb, and this is balsam phoenic is mixed with fennel, and this seemed to relax the bowels as well. Spirit of lavender is very popular, where to get the spirit from these things, lots of medicines were prescribed as spirits, and that means that they were distilled. They would take the herb or whatever they were interested in, and they would make a liquid preparation of this, and then they would boil it, and they would collect the distillate, just like you do in a brewery. Distillery. Laxatives, also very popular. Lots of things to help that. Rhubarb, Dr. Roby used a lot of rhubarb. Saffron, manna is another plant, and cream of tartar, which still is used today. In fact, all these things can be used. In fact, when I was reading about all this stuff, when you Google some of these strange things that you don't normally see, you get all these websites for health food stores, and they're selling this now. You know, how much do you want? How many tons of stuff? So they still seem to work. It's not like, you know, we just don't. It's easier to go to see your primary care doc and get a prescription for I don't know, let's say antiemetics to try to clear up nausea, as you might expect, involved herbs like mint, cloves, pennyroyal, and wormwood, which is material that's used in making absinthe, was very popular back then to relieve vomiting, although often they thought vomiting was good, but, so sometimes they didn't like to use these. Antispasm were often prescribed, most popular being, with Dr. Roby, were being castor, which is not castor oil, or the castor bean. That was used, as you'll see later, for something else. But the castor is a chemical or some oil obtained from a gland in the beaver, near its anus, believe it or not, and was very, very popular as an antispasmodic type of treatment. What antispasm means, when you look through those old prescriptions, they don't say what they mean by spasm, but you get the impression it could be anything from epilepsy to a hysterical fit. You know, I think it's all. So these might be the equivalents of tranquilizers today. Belladonna, a deadly nightshade, which takes atropine, also was quite good at calming you down if you're not too careful. Valerian root, they're still used today as a health food, but it was very popular back then for people with what were considered spasmodic problems. Demulcents is a term for a soothing agent, and these were used a lot. You sometimes wonder when you look through the old prescriptions whether they were used because they really worked or because it was just to calm people and reassure them that they'll be okay. Balsams, which are preparations made from resins, again, mainly from fir trees or evergreen trees, which were often mixed with other herbs like fennel. For example, we've got balsam fennel here used as a gas medicine, but often they were used just to soothe. If you rub it on the skin, if it was painful from an injury or something, it would seem to relieve the pain. Spermaceti was used a lot. And spermaceti is a waxy material that's obtained from the head of a sperm whale. And its major use was as an oil for lighting lamps, because it gives a very, very clean, clear light. But it was also thought to be very good as a soothing agent, particularly in medicine. And again, myrrh, particularly for mouth problems, soreness and discomfort in the mouth, was used a lot. So they're the palliatives. These are the medicines that are pleasant, you know, that can make you feel better. The other group of chemicals are considered radicals. These are not meant to make you feel good. This is meant to cure you. These are meant to produce all the things that could get rid of those bad humors. And you do that, as we've said earlier, by sweating, purging, vomiting, diuresing, blistering, bleeding. Sweating could be done by lots of things, but the most popular were mercury compounds. Mercury was used a lot, and it was continued to be used all the way up into the end of the 19th century. Antimony chemicals were very popular. And snake root, interestingly, was a preparation herb that the Native Americans used. And when the colonists came over, they learned a lot of things from the Native Americans as far as using medicines were concerned. But snake root they liked a lot, and Rhodey used it quite a lot to help people sweat. Purging, to clean out your bowels. Aloes were very popular. Castor oil, now this is from the castor bean, not from the beaver. Jalap root, another herb. And rhubarb, at this time in much higher doses than you'd use for a laxative. Vomiting was pretty easy to produce as well. Ipecac was a plant that we still use today. Occasionally, if you need to make someone vomit, if they swallowed a poison, something, and you want to get it out quickly, you give them Ipecac, which is a chemical obtained from a plant called Ipecac. Arsenic and antimony chemicals again. This one, antimony tartrate, was known as tartar emetic. Very powerful emetic agent. Diuresing, it's more difficult to do. Not so many things really clearly made you urinate more, but there's a herb called squill. It seemed to help. Mercury again, it seemed to be useful for everything. And later in the 18th century, digitalis came along, which, as you know, is from the leaf of the foxglove, and it was miraculous almost in getting rid of fluid from people. You know, it would eventually come out of their kidneys, but it would disappear from wherever it was collecting in their legs or in their abdomen. And it was thought for a long time that this drug actually was a diuretic that worked on the kidneys. It wasn't until much, much later, end of the 19th century, that people knew more about how the heart worked physiologically, that they were able to show that this actually was working in the heart. But it had been used at the very end of the 18th century where it first came in. Blistering was popular, and certainly with Dr. Roby, he liked to use something called emplasticum epiplasticum. Emplasticum means a plaster, like a salve. Epiplasticum means over the skin. And basically what this contained was several ingredients. You'd start out with a piece of linen, and you make a plaster by putting down some pitch, some wax, some pepper, and mustard. But the most important ingredient was a crushed beetle, which is commonly known as Spanish fly. And this is incredibly irritating to the skin and will produce enormous blisters. And I'm not going to show you any pictures of them because they're not very nice on a Sunday afternoon. And bleeding. It's not a medicine, of course, but bleeding was a radical treatment. And there are different ways that was done. Most common was phlebotomy or cutting into a vein. But you could also, if you wanted to do a more localized type of bleeding, you could use something called scarification, where you literally scratch the skin, and there were devices made, and I'll show you some later, that would just cut a little, cut into the superficial part of the skin to get a local bleed. And leeches also were very popular, not so much in North America, but certainly on the European continent. And in fact, towards the end of the 19th century, apparently the world supply of leeches was disappearing because they were so popular in France. People were putting leeches all over people's bodies that there was a danger that they would literally run out. So if you wanted, or if the physician wanted the patient to lose blood, he wouldn't go to the apothecary, he would go to the surgeon. And this is the kind of scene that you can imagine. Probably never happened like this, but this is the concept where you have a physician who has a patient, and he's taken her to the surgeon, and what he's got is a beaker here with urine from this patient, which he's used to make his diagnosis. And he has decided that this patient needs to be bled. She's got too much blood, too much bad humour floating around in her blood, needs to come out. So he will prescribe for this patient, he will go to the surgeon and will say, I want you to remove, say, 8 ounces of blood from this lady from her left arm, and then she'll be fine. The blood, blood is most commonly removed from the arm because it's the most simple, most convenient place. But in the early days of bleeding, blood could be taken from literally any part of the body. And there are all sorts of reasons why it would be better to take it from one part or another. If you had a disease of the spleen, say, which is on the left side of the body, they often would bleed from the left arm. If you had disease of the liver, you'd take it from the arm on that side, on the right side. I remember when I was a medical student learning that there's a vein in your arm called the cephalic vein. It's just above your thumb. And I never understood quite why it was called the cephalic vein. And it turns out that a long time ago it was thought that this vein connected directly to your head. And if you had a problem in the head, if you cut and bled from that vein, it would sort of locally relieve the humours from that area. And in fact, a lot of veins were given names like the splenic vein and the hepatic vein in the skin, not to the organ. There were all sorts of wild and crazy theories about taking blood. But certainly, Dr. Roby, in his accounts, reports how he took, on one woman, blood from her legs, from her feet, he said. And this was a popular thing, certainly with women, if they were having bleeding problems, certainly if they were related to pregnancy. It was felt that, you should take blood from a part of the body lower than where the clinical problem is. So these ideas persist for a very long time. Now, most surgeons had another occupation. The reason they did these medical work was because they had access to sharp knives and pliers and saws and things like that. And they had other jobs. They didn't make a living just doing medical work. And many of them were barbers, because barbers are very good at using razors, particularly. They're used to cutting people, believe it or not. And they had devices kind of like this, which they could hold under someone's chin, like shaving them, so that if they got cut, they wouldn't get blood on their shirt. Also, they could, like this man is rinsing his razor in some water in it. So, these, as you'll see, one of Dr. Roby's patients was a barber, and you see what happened to him. But the surgeons were very few of them until quite late on became full-time surgeons. The other thing that the physicians didn't do and would send the patients for was removing teeth. This was a very active thing in the 18th century. One of the main reasons for that is that sugar became very, refined sugar became very abundant with all the plantations in the West Indies particularly. And North America had more of a problem than Europe did because it was much cheaper here to get sugar, and people loved it, as you can imagine. And as a result, they had rotten teeth. Eventually they would come out, and again, this would be done by a physician. Normally, it would be done by a surgeon. The last person in that list of other practitioners was the midwife. Now, the midwife invariably was a woman who assisted with the birth or delivery of a pregnant woman. And physicians were very rarely involved with childbirth unless there was a serious problem. And it was tough for the midwife because they couldn't win. If the delivery went badly, they always blamed the midwife. Something she did or didn't do right. Sometimes the physician would literally, his job would be just to try to save the life of the mother by getting what was left of the baby out in any way he could. If the midwife was too successful, had too many healthy deliveries, she was at risk of being accused of witchcraft, which happened, as you know, certainly in the 17th century. So things did change eventually. Now, this is kind of how people tried to practice medicine certainly in Massachusetts and in New England, because this is how it was done in England, by separating out these different responsibilities. It was considered very bad practice for a physician to make up his own medicines or to do surgery. They felt that's not your job. You have to use your brain, not use your hands. But in New England, and certainly in an area like this in the 18th century, that just wasn't realistic. There just weren't enough doctors, and there weren't enough anybody to do all that sort of work. So the physician was forced to do all these different functions. And as we'll see, Dr. Roby here was a good example of a physician who did all these different jobs. And this is a picture I like, which sort of shows, I think, the role of the physician in the 18th century, going to someone's house. He's got his riding boots on, so he's had to ride out there, bring his medicines with him, bring his tools with him, and literally have a hands-on practice of taking care of his patient. You also notice there's a basket of flowers here. He might have taken some of those to use as medicines. So as far as medicines are concerned, because he had to travel quite a bit to see his patients, he would probably ride on a horse. And so he would need a saddlebag that could contain bottles of medicine. And as you know, we have Dr. Roby's juniors, Dr. Roby's son's saddlebags here, which gives you an idea that they're not very large, and so they couldn't really carry a lot of medicine with them. So they would have to pick the ones they thought were going to be most helpful. I guess somebody would come to his office and say, my father or my child is sick, can you come out? And he'd say, oh, what's the problem? And I'll see what I can do, get his medicines for him. So he would have to be prepared to give medicines on the spot like that. He would also do other jobs that were normally done by surgeons, such as setting fractures, like you see here, treating superficial wounds, with plasters. He would also have to do his own bloodletting. And he probably wouldn't like to use a razor like a barber. And this is an example of the type of razors that they would have used, because they're sharp, but they're big, and it would be very easy to cause some damage. So he would use better designed instruments, as you can see here. And I have some examples, and you're all welcome to come up and take a look at these later on. But what we see here are the sort of things that a physician would have used for doing his own bloodletting. This is a thing called a lancet, just a very sharp blade. But after that, a device called a fleam was developed, which has just got a very small blade on it. And they would hold that over the vein and then tap it. And they would cut it that way. There's also a thing, it's in here, which is a spring-loaded fleam, where you would have a little device like this, and you pull back the spring. But be careful, I don't chop my fingers off. It could happen. And you put it back, and then place it over the vein, and then click, and there you go. But that was devised so that the physician could get somebody to help him, someone off the street, say, would you do me a favor, would you? All you got to do is pull back the spring, don't try and be clever. And most physicians would have a jar containing leeches, although Dr. Roby didn't seem to like leeches. I never saw any use of them, but he liked to use blisters, which did basically the same thing. Now, the physician would also take over the pulling of teeth. But he was lucky in that this device had been invented by the middle 18th century, and it's a thing called a tooth key. And the way this worked is illustrated here. You put the gripping part on the tooth, and you try to distract the patient somehow by telling them to think pure thoughts, and then with a rapid twist of the wrist, out comes the tooth. And Dr. Roby did lots of these. Before we actually get to Dr. Roby, let's run through the type of diseases that he might have seen. It's a little difficult to know exactly what was going on, certainly from his account books, because he doesn't describe the symptoms or problems of his patients. But we know from Wayland's vital statistics, collected up until 1850, what people died from. And these are the most common diseases recorded. And these are very familiar to us now, although not as common as they used to be, and with different names. The most common thing they saw was something they called apoplexy, which simply means sudden death preceded by a period of loss of consciousness. And obviously we wouldn't diagnose it like that today. We would figure out that someone had a heart attack or a stroke. That would have been that sort of problem. Childbed fever, which we were talking about a bit more, was very common. You'd be amazed. Mothers delivering a baby in America in general, but I think it's the same in New England. Approximately 1% of mothers died from infection within a week after delivery. It actually got worse for a while as women started going to what we called lying-in hospitals to have their babies. It was thought, in the old days of the midwives, you get about 1% of mothers dying of infection. And it was thought, well, women really need a doctor in a hospital to deliver their baby. And so women went to these hospitals, and they had what would be considered good care, but there was absolutely no asepsis. There was no evidence or attempt to prevent infection. And the actual maternal or so-called puerperal fever rate increased dramatically in those hospitals. So we figured out what was going on. Consumption is where people literally wasted away, and if it was chest consumption, it was most likely TB, but it could have been lung cancer. The people just weren't able to diagnose that then. Croup, which is when you develop a sudden barking cough. In children, this can be fatal as it was. We rarely see that anymore. Dropsy, the word dropsy comes from hydrops, which means water. and it just meant collecting water, most commonly in the legs, but it could also be in the chest and in the head. And it was, some people, it was considered the cause of death. It probably, you wouldn't die from having water in your legs necessarily, but obviously what has caused that, usually heart failure, would have been the actual reason. Dysentery, again, this could be due to lots of different reasons, but plenty of people died as a result of or certainly bowel infections. Erysipelas is something we rarely see anymore, but it was a significant cause of death back then, and it's basically a strep throat infection that develops to involve the skin, and it was known commonly as the face gets very red and hot, and it used to be known as St. Anthony's fire, and the name persisted for a long time. Quite a lot of famous people died from that. The Pope in 18 something or other died from it. But it's sort of it's interesting that this sort of harks back to the days when diseases were all thought to be related to some kind of supernatural effect, and people would pray to different saints depending on what disease and what condition they had. And people with this condition would pray to St. Anthony, and probably still do. Fevers were a cause of death. Fever really means nothing to us anymore. We want to know what's causing it. And all they could do at that time was to describe what kind of a fever it was. Fevers could be acute. People could get very sick and very hot and die. And that would probably be a very severe bacterial infection and septicemia. But it could last a long time. It could come and go. And they recognize different patterns of fever. And the so-called remitting fevers were usually due to malaria. And in fact, as before people knew what malaria was, the term malaria was used simply meaning bad air. It was known that if you were close to swamps, particularly in the hot weather, that you were more likely to get these remitting fevers that could be deadly. And so they thought there was something in the air. So the word malaria comes from that. The term influenza, if you know, is an Italian word meaning influence, and it goes back again to the humoral theory, where people really didn't know where diseases started from, and they thought there was an influence. They knew there was sort of a contagious aspect to it. Somehow these things seem to spread around, and they just said there was an influence in the air. No idea what that was, but the name influenza comes from that. Fits, obviously, could have been epileptic fits, or it could have been, more likely, in older people, would have been brain tumors. Measles, very common, tended to be epidemic, and killed lots of children back then. Palsy could mean something following a stroke or something more chronic, neurological. Pleurisy, disease in the chest causing pain with breathing, was common. Smallpox was common, but got to be less so towards the end of the 18th century due to the development of immunizations against the disease. Typhus was a form of fever that was deadly, often was known as jail fever or camp fever, because it tended to occur when groups of people were sort of herded together for a long time. And we now know it's due to lice carrying a bacterium. Typhoid was so called because it was often confused with typhus until they actually figured out there was a different organism, Salmonella, causing it. And scarlet fever, like erysipelas, is a condition where you start with a streptococcal infection, usually in the throat, that spreads to the whole body and causes damage to the heart and joints and other organs, and without any kind of treatment at all, it was fatal. So these are the sort of conditions that he would have seen. Now, just want to talk about Dr. Roby for a little while. Do you all know about Dr. Roby here? You're all Waylanders, right? So this is probably familiar to you, but this was news to me. I learned this just recently, but I'd like to kind of go over it for you if you're not familiar with this, because it's fascinating information, I think. Dr. Roby, Sr., was born in Boston in 1701. He graduated from Harvard after 4 years in 1719, so he was only 18 years old. He didn't come from a medical background. He didn't even come from an academic background, as far as I can tell, but he had a brother who was a tutor at Harvard at this time, and probably helped to get him in. After he graduated, he actually taught at a school for a while. He didn't go into medicine, but he decided he wanted to go into medicine. So, as I mentioned earlier, he wouldn't have any practical training. So to get that, he actually did an apprenticeship in 1723 with another doctor called Thomas Berry in Ipswich, who was apparently a leading physician of the time. He apparently, in 1725, spent some time as an army surgeon during the Indian troubles. And this was a great way for a doctor to get practical experience in surgery. You can imagine with an army and at war, you're going to see lots of surgical problems. Before he actually went into practice, he took a trip to Holland in 1726. And he spent time visiting the universities in Amsterdam and Leuven. And that was really quite interesting. He kept a diary, and this is well documented, showing how he visited the hospitals and also what were called the Physick gardens. Most universities in that era had a garden of herbs that were used for medicines, and it was where apothecaries could train, could learn about these different plants and how to use them. And he visited them, he describes these plants. And before he came back to America, he spent a few weeks in England visiting his ancestors. They came from a place called Castle Doddington in Leicestershire. And he went back and visited with them, and they made him very welcome. And he gave him a copy of the genealogy of the family, which he brought back. So when he came back to America, he settled in what was then the parish of East Sudbury. Shortly after Dr. Loring had taken off for the west side. And he built a house in the town centre, literally within a stone's throw from here. In 1729, age of 28, he married Sarah Swift, who was the daughter of the first minister of Framingham, who was a very influential man who also owned several slaves. In 1732, his first son, or first child rather, was born, called Edmund Roby Jr., and he went on to become a physician like his father and worked with him quite a lot. In 1734, he became a justice of the peace, which was interesting, I thought, because I think in that era, in towns like this, educated, prominent men often got involved in town community affairs, became selectmen or justice of the peace. 1739, his first daughter Mary was born, and in 1742, his second daughter Anne was born. Anne was born on the 12th of June, 1742. On the 20th of June, 1742, his wife died. So clearly, that was a case of childbed fever, as it was known then, which is very tragic. You know that Dr. Roby, whose job is to help people like that, his own wife died. So you can imagine how helpless he must have felt at the time. And we'll hear more about that in just a little while. He got on with his work. He continued to work very hard, and literally till he died in 1772. During that time, as he did when he was a young man, he took on apprentices. And one of the best-known apprentices was a man called Oliver Prescott, who was the brother of William Prescott, and both of them were fighting at Bunker Hill. William Prescott became sort of known as the hero of Bunker Hill, and there's a statue up there. So Dr. Roby eventually died, and he's buried in the North Cemetery here. And on the tombstone it says, he fixed his residence in Sudbury in the character of a physician, where he was long distinguished for his ability and success in the healing art. Now we're going to take a look through his account book. He kept very, very good records of everything he did that involved money. And these are account books which people did in those days. I guess you had to keep your own account book, because there weren't banks and things like that to do it for you. And there are over the book that I had access to is online now with the Harvard Library, and contains over 300 pages And each page contains 2 or 3 different people's names, so you get a feel for how busy he was. And this is just one book of at least 4 that he had. But some of the names may be familiar to many of you here from this town. John Grout, Sudbury, back in 1752, was seen several times during this period. I'm just going to run through a few of these things. The way the book was set out, you'd have the date on this side, the name of his patient, and what he charged them for, and how much he charged them in pounds, shillings, and pence. And you can see right away on May the 3rd, he was seen every day for about a week, this John Grout. And the first day he was given epis, which is emplasticum epispasticum, which is that blister treatment. He was also given some spirit of lavender, which is something to settle his bowels, and some sal ammonia, salt of ammonium, which is ammonium chloride, which also is to relieve his bowels somewhat. So aniseed, Sam Anis, and visit. He had to go to visit him, so he charged him 1 shilling and 6pence for the visit. The next day he went back, gave him some balsam with fennel in it, sort of as a sort of soothing medicine, and also some sulfur in the balsam as well, just probably to make him feel a bit better with this blister going on. On the 5th, the next day, he was given which is pulverized ipecac, powdered ipecac, which is the stuff that makes you vomit. So things are not looking too good here. I think he's decided we need to go up a gear. The blisters aren't doing it, so we're going to purge you a little bit. So he gave him ipecac to make him vomit, and then he gave him epis, which is the emplastum epispasticum, the blistering plaster. Again, gave him another one. A little spirit of lavender and salt of ammonia, calm his bowels down a little bit. Same again on this next day. It looks like he's just got sal ammoniac there, so that's better. So this time we were seen in July. He was given ipecac again to make him vomit, and emplastum corroborum, plaster, strengthening plaster. Now, what's curious here, it's got here date or data, Sarah. I don't know if anyone's familiar with the family, but he had a daughter, Sarah, and I don't know if this was for her. But when these so-called strengthening plasters were given to women, it was usually because they were having a threatened miscarriage or a gynecological problem like that. It was thought these plasters put on the abdomen, which contained various herbs, which are thought to strengthen. Tincture sacra is a tincture, an alcoholic mixture of aloes and myrrh. Another strengthening plaster. Again, I don't know who that was for, but tincture sacra. Anyway, this goes along. He's giving Catharides. Now, Catharides is the Latin name for the Spanish fly. So, Catharides meliot is a plaster of Spanish fly with something sticky to make it stick. So he's getting lots of blistering, that's for sure. Balsa pelagia is a balsa made with pennyroyal. Aniseed, and balsam pelagia again. Then he pulverized, and this symbol, it's like a 6 and a 9. And I couldn't figure out what this was, but then I realized this is symbol for a crab. You know, cancer, the crab, sort of apothecary symbol. And they used to use something called pulverized crab's eyes in those days, which was little chalky things that were taken out of crayfish and were basically calcium carbonate, I think, and they were good for, as you would expect, for acid indigestion. I think that's what's going on there. But the thing that caught my eye, on the 21st of April, 1753, he was given something called pill roofie, which is a pill containing aloes, saffron, and myrrh, which is sort of something to make you sweat. And he was given this symbol, and this is the symbol for mercury. So he's given mercury, another Plastum epispasticum, blistering plaster again. So he's really throwing the book at him here. So this is pretty typical. When you go through this book, this is what you see. This is the sort of thing he's doing pretty much every day. Another name that might be familiar is Captain Nixon of Framingham. So this is John Nixon, who was better known really as captain of the South Sudbury Minute Company during the Revolutionary War. But he was involved very much in the French and Indian War as well. He signed up when he was 17 years old, and he was away most of his young life. And he actually was born in Framingham. His children were baptized in Framingham, although he lived in Sudbury at the top of Knobscott Hill, where the cellar hole of his house still exists. But he wasn't seen very often because he was off fighting the wars all the time. But 1760, February the 3rd, he had a bleeding and an emetic and epispastic, with blistering plaster. So here again, he's getting hit pretty hard. Bleeding, purging, blistering. That's almost like a full house, isn't it? The only thing he hasn't had is purging. But that's to come. So he's given some sal volatile, which is a sort of a laxative. And this was done, interestingly, by Ebenezer Jr. So this is 1760 now, and Ebenezer was born in 1742, I think it was. 32, thank you. So what is he? He's 28. So, and he's been working with his father for some time now. So a lot of the times you see, he'll say, per Ebenezer. So clearly he's helping his father. On the 7th, he was given gut, which is drops of an anti-epileptic medicine. This is a symbol for 1 ounce. Anti-epileptic again. Lots of drops of anti-epileptic drops and bleeding. Anti-epileptic drops and a bottle of it. Interestingly, there was no visit there, so he must have gone to his house and said, "Can you give me some more of those drops?" Sang Draconius is dragon's blood. And this was a preparation that was imported, again from the Middle East, which was a red resin that was thought to be good for healing wounds and stopping bleeding as an astringent. But he liked to use this quite a bit. And then towards the end he's given the pill roofing and so on. So that's another example. I wanted to show this very briefly. I know there's a lot of writing here, and I don't want to bore you too much, but I just wanted to point out that Adam Beattie of Sudbury was a barber, and he had lots of work done, lots of medicines for elixir for his stomach, and like everybody else, he was bleeding there. His wife was bled a few times. But the thing I thought was interesting, he's a barber. He was bled several times, and obviously didn't do his own bleeding. But on the other side of the book, the page on the other side, it shows how Mr. Beattie paid him back. And he paid him back being a barber. He's made Ebenezer, his son, a wig. Dr. Ebenezer Sr. Found the hair. And also he had shaving, a wig, shaving, wig for Ebenezer, shaving. So this is how he paid him back. In fact, most of his patients paid him back not with cash. Cash was, I guess, pretty hard to find in those days. But people paid him back by doing work or for example, doing a useful job. I just want to show this very quickly. John Tilton is well known in this town because he's one of the men who was instrumental in separating the east side from the west side in 1778. He was the leader of the group that did that, and he was seen by Dr. Roby several times. Mainly in this particular piece of time, he was dressing wounds. This is dress wound. And he gave him some blistering plaster as well for his mother, dressing his wound, and this is, you see this a lot, extracting tooth. So he did that as well. He must have had one of those gadgets. And then he dressed his wound. Ditto. So he also, being this as a Campbell, I don't know if he raised cattle or anything, but he frequently charges people for a quarter of beef or a quarter of lamb, a hind quarter. So it went both ways. One thing that struck me about Jason Gleason Jr. is, I mentioned earlier, it was popular in this era for people to have regular purgings, but some people seem to have regular bleedings as well, because these people seem to get bled just about once a month. He and his wife, Jason and his wife, bleeding his wife, emetic, let's see, bleeding his wife, that was him. There's a blistering plaster there, bleeding, Physick, bleeding, and bleeding. So it goes cantharides, is a bleeding plaster again. So it's quite fascinating just to see how some people got bled and blistered quite a lot. Now Samuel Howe of Sudbury didn't have a particularly fascinating medical history. He got the same kind of things, same sort of drugs, spirit of lavender, blistering plaster, bolts of sulfur, very popular bleeding, and so on and so forth. But what I found fascinating about him, he was a cordwainer. And a cordwainer is an old term for a man who made shoes. And so this is how he paid him back. He paid him back with shoes for Ebenezer, and more shoes for Ebenezer, and 2 pairs of shoes for Mary and Anne. They were his daughters. So that's good, isn't it? You get to this clothes sort of taken care of. And this is the last thing I just wanted to see, somewhat poignant, is that this is Edmund Parmenter of Sudbury. 1757, April the 21st. You can see the picture where Dr. Roby has been called to see his wife. And he gave her a powder preparation of something called partum provocans. Partum meaning childbirth, delivery. Provocans means to provoke. So it sounds like she was having a difficult time. He gave her myrrh, which is a soothing kind of agent, and he gave her some castor, which is a sort of like the antispasm thing, spirit of castor to help calm her down, I suspect. Pulverized myrrh. Medicine number 6. Apothecaries often kept some of their preparations secret because they didn't want other people to steal them because they were so good, and they would just have a number, so you know has any idea what that is. And anyway, he said, deliver your wife. And that's the term they used to use in those days. You didn't deliver the baby, you delivered the wife. And he made a journey in the night. So this was quite an expensive trip for Edmund, £4. That's as much as anyone ever paid, I think, for anything. And that's for the whole visit, because he came back a week later, and he gave, presumably, his wife a spirit of sal-ammoniac, and something called an emplaster, a plaster galbani. And this was given to women who were having what was described as hysterical disease. Hysterical meaning related to the uterus. And she clearly was having a terrible time. And this plaster would be put over the navel. And it was thought that the uterus was moving around, and they needed to sort of stop it moving. And that's why he did that. And he gave us some powdered myrrh, which is sort of a soothing agent. And I was intrigued by this because there's no other entry in his records of this man or his wife. And when I looked in the vital records of Wayland, it turns out that his wife died that night. And there is no record of a baby. So I suspect this is what happened in those days. If a baby died before or after childbirth, it was not recorded in the town statistics as a death. And I didn't go through all his records, but you do see quite a few situations that look like that, where you see delivered your wife, and then you try to find out if in the genealogy of the family or the vital records there's a record of a birth, and there isn't. So presumably that's what happened. So just want to finish up just by re-emphasizing just how serious maternal mortality was. There aren't statistics, for that era, Dr. Roby's era, because people just weren't collecting them, and if they did, they're probably inaccurate. But people started collecting records around about 1900, and even at that time, the maternal mortality rate was about nearly 1,000 in 100,000, so that's about 1%. And it wasn't really until about 1940 or 50, when antibiotics became available, that it suddenly plunged. So now, as you know, maternal mortality is very, very small. Infant mortality, same problem. We don't have good records until about 1915, but even at that time, there were about 100 infant deaths per 1,000 live births, 10%. And again, with the onset, really just good antisepsis, really, and good gynecological care. This started coming down much sooner than the maternal days. So anyway, one piece of good news is that although times were bad back then, and the average survival, the life expectancy was only about 35 years or so, it has come up, and it has continued to go up. And I'd like to just finish up with this little ditty that I ran across, which doesn't apply to Dr. Roby, but applies to people's attitudes toward doctors in England in the 18th century. When patients come to I physics, bleeds and sweats them. Then, if they choose to die, that's what I do. I lecture. So that's it. So thank you very much for your attention. Thank you. As you can see, we've got Dr. Roby's saddlebags here, which are fascinating. They're for his son, but I suspect his father might have used those as well. And they're the things he would have had on his horse to take medicines to these patients. And if you're interested in this stuff, there's if you just Google Dr. Roby's account book, you'll run across it. It's online in our library, and you can read all this stuff. But I warn you, it's hard work trying to figure out what it all means. But it's a wonderful way to learn a little about the town's history, because these are actual things that happen to real people. You know the time and the place. What you don't know is, what really was going on. You just know what the end result was. But we have some instruments we brought along here as well. I brought along. If you want to take a look at them and ask them questions, then please go ahead. So thank you all very much, and I'll take you.